Hi there, I'm Tony Buck and I'm one of the co-founders of VitalTalk. I'm here today to help introduce the case for communication skills by giving you a quick summary of why communication skills are so important. Since I was an intern, we've been talking about how important communication is. But when I was trained, what we talked about was the art of communication. We talked about physicians who are good at explaining things, as if it were kind of a matter of charisma rather than a matter of skill. And we assumed that you had to be born like this, that you couldn't learn to do it. And in fact, a lot of educators and master clinicians would kind of look askance at the idea of trying to train people to communicate. Fast forward a couple of decades, and it turns out that what we assumed back in those days was actually totally incorrect. Lots of studies have shown that clinicians acquire communication skills by learning them. And what's more important is that the studies also show that clinicians who have not been trained don't assess their own skills accurately, and there is widespread divergence between what clinicians think about their own skills and what their patients think. It also turns out that having communication skills that allow you to understand what patients are concerned about, elicit their values, talk about their goals, and make recommendations about treatments that match those goals, it turns out that those are related to a whole bunch of other outcomes. Communication skills that enable you to engage with a patient using empathy and using sophisticated information techniques. Those kinds of sophisticated communication skills enable patients to be less likely to be readmitted to the hospital. We've also learned that the right kind of communication skills training actually changes clinician behavior. And importantly, it changes clinician behavior from talking and talking and talking at a patient, and we have reams of transcripts from research studies that document this, to clinicians who find out where patients are, give information in small bites, stop and address emotion when it comes up, and all those techniques turn out to increase how much information patients retain. And that leads to more realistic decision making and eventually medical treatments that match what patients really care about. The research has also made it clear that clinicians don't get better at communication just because they're more experienced or just because they're older. In fact, what the research shows us that those clinicians, if they haven't had training, are more likely to be using the same bad habits 20 years later that they developed when they were in training. The National Academy of Sciences is just one of the major professional organizations in the United States that now endorses the importance of communication skills training. More recently, we've learned that combining communication skills training with workflow redesign that enables physicians to know which patients to talk to document those conversations in the electronic medical record in an accessible way, and for systems to look at these conversations at the population level. All those are really powerful levers. So it's now clear that not addressing communication skills, i.e., continuing with the status quo, is actually a huge barrier to improving the care of patients who have a serious illness. And VitalTalk, the Center to Advance Palliative Care, and Ariadne Labs, the Serious Illness Care Program, have gotten together to create a scalable solution to improve the situation. The first step of it is this Communication Skills Pathfinder, and the idea of it is to enable you to find out a communication skills solution for the issue that you face, either as a clinician or as a health system. As we look towards the future of better care in the United States, it's really clear that the shift to value-based payment is going to make a huge difference in the ability of systems to invest in these kinds of solutions. And we're really proud to be offering something that we think is the state of the science. I'm guessing that you're probably watching this because you're a change agent in your organization. Please reach out to us and tell us what you need. We'd love to talk to you. See you later.